In this video, let's begin with an introduction of hematology and pathology. So, hematopoiesis starts in the third week of intrauterine life. It starts in the yolk sac, and then in the third month of intrauterine life, it starts occurring in the liver. And in the fourth month of intrauterine life, it starts occurring in the bone marrow and the liver. Just before birth, the bone marrow takes entire responsibility of hematopoiesis. So third week, it starts in the yolk sac till third month, and third month liver takes over. In the fourth month, bone marrow and liver take over. Just before birth, it's only the bone marrow. And hematopoiesis, it occurs in flat bones like the ribs, the sternum, and the pelvis, the hip bone. Okay, so this is the hematopoietic stem cell. The marker to identify it, the CD marker is CD34. Okay, so it differentiates into two types: common lymphoid progenitor, common myeloid progenitor. Lymphoid progenitor gives rise to all sorts of lymphocytes, so T lymphocytes, B lymphocytes, and natural killer cells, NK cells. Common myeloid progenitor gives rise to your RBCs, erythroblast RBCs, megakaryoblast, megakaryocyte, and your platelets. And myeloblast, okay, myeloblasts give rise to everything except monocytes, because monoblasts give rise to monocytes. So myeloblasts give rise to neutrophils, eosinophils, and basophils. Okay. Moving on to WBCs. So WBCs are derived from the myeloid series, the myeloblast. So first you have the myeloblast, then promyelocyte, myelocyte, metamyelocyte, band form, and neutrophils. The size keeps decreasing as the cell stage advances. So promyelocyte is the largest cell, and myelocyte is when there is a decision taken by the cell to either become an eosinophil or a basophil or a neutrophil. What is that? Myelocyte. So normal TLC, total leukocyte count, is 4,000 to 11,000 per mm cube. So WBCs, they can be classified into granulocytes and agranulocytes. So the trick to remember is BANG, so B-E-N-G. So basophils, eosinophils, and neutrophils are granulocytes. They have granules in the cytoplasm, whereas agranulocytes, they're lymphocytes and monocytes. So how do you identify WBC on a peripheral smear? So if you take a look at this peripheral smear, you can easily identify the RBCs. Okay, you can easily identify the RBCs, and you can easily identify the cellular fragments, platelets. So now moving on to the neutrophils. So as you can see here, this is a neutrophil. A neutrophil normally has 3 to 5 lobes. Okay, and there are bluish granules in the cytoplasm, as you can see here. Okay, whereas coming to the eosinophil has brick red granules in the cytoplasm, and also it is binucleate. It is spectacle shaped. SC, C, you see with spectacles, right? So bilobed nucleus, binucleate, or brick red granules. Now moving on to basophils, the entire cell, the entire nucleus, the entire cytoplasm is obscured by bluish granules. So that is a basophil. Okay, and then monocytes have a kidney-shaped nucleus. So monocytes have a kidney-shaped nucleus, and also they don't have any granules in the cytoplasm. So the cytoplasm appears homogeneous without granules. And then lymphocytes, you can see it is it also doesn't have any granules in the cytoplasm, and you can see the nucleus. All right. So that is about the identification of WBCs on the peripheral smear. And lymphocytes, you can see no nucleoli also, but remember that you can't see any granules in the cytoplasm. That is enough. Moving on to non-neoplastic disorders of WBC, you have two types: leukopenia and leukocytosis. So cytosis is an increase in the WBC count, and it occurs when there is reactive proliferation of WBC. Leukopenia is a decrease in the WBC count, usually due to neutropenia. So if you want to remember the DLC, it is NLM-AB, okay. So neutrophils are most in number. So leukopenia is seen usually when there is neutropenia, and the causes are aplastic anemia and drug toxicity. So agranulocytosis, cytosis usually refers to an increase, right? But here you have A. So agranulocytosis is a decrease, clinically significant decrease in the WBC count, mostly due to decrease in neutrophils, obviously. And neutrophilia is an increase in the neutrophil count. Normal DLC is 40 to 70%. The causes are acute infection, tissue injury like myocardial infarction, burns, and bacterial infections. So bacterial infections and acute inflammatory conditions cause increase in neutrophils. And myeloproliferative disorders like chronic myeloid leukemia also cause neutrophilia. Whereas eosinophilia, the normal eosinophil count is EB, okay. So 1 to 6%. The causes are allergic reactions and type 1 hypersensitivity reactions, and parasitic infections or helminthic infestations like ascariasis or hay fever. So hay fever is not a helminthic thing, but yeah. And tropical pulmonary eosinophilia. Normal basophil count is less than 1. So basophilia is seen in chronic myeloid leukemia. So remember this PC. So if you see basophils, if you see more basophils, then it is CML. Okay. And lymphocyte count normal is 15 to 40%. The causes are chronic conditions or chronic inflammations and tuberculosis also, and viral infections. Bacterial, you saw neutrophilia. So viral infections, you see an increase in lymphocytes. So lymphoproliferative disorders such as ALL or CLL, they also cause an increase in lymphocytes. Normal monocyte count is 2 to 8%. As soon as you see an increase in monocytes, suspect malaria and search for malaria. Endocarditis otherwise, or rickettsiosis or viral infections. So moving on to the morphological abnormalities of WBC. So in the peripheral smear, if you see toxic granules like this, coarse and dark granules in the neutrophils, or if you see patches of dilated endoplasmic reticulum like this, they're called Dole's bodies. You can see the blue thing here. Okay, so that is a Dole body. So when you see Dole bodies or toxic granules, it indicates sepsis or infection in the person. So neutrophil is present on peripheral smear. It could be hyper or hyposegmented, so as you can see here. So basically it has 3 to 5 lobes, right? As soon as you think about a neutrophil, you know it has 3 to 5 lobes. If there are more number of lobes greater than 5, it is hypersegmented. Okay, and it is seen in megaloblastic anemia due to vitamin B12 deficiency. And hyposegmented normal is 3 to 5. So if you see less than 2 or 2 lobes, so it is seen in myelodysplastic syndrome. It is called a pseudo-Pelger-Huet cell. Okay, and then moving on to the other anomalies. So May-Heglin anomaly. So you can see giant platelets. Okay, as you can see here, giant platelets, and in the platelets you can see inclusions within the cytoplasm. Okay, that is a May-Heglin anomaly. Giant platelets and inclusions within the platelets. Okay, and here you can see Chediak-Higashi syndrome. So here you can see dark purplish granules in the cytoplasm and giant granules in the neutrophils. Okay, that is Chediak-Higashi syndrome. And Alder-Rayleigh abnormality. So most of the neutrophils have granules that obscure the nucleus. So Alder-Rayleigh, really? You're obscuring the whole nucleus of the neutrophils? Yeah. So that is Alder-Rayleigh syndrome. May-Heglin anomaly, there are inclusions within the cytoplasm and there is a low platelet count and there are giant platelets. Moving on to neoplastic lesions of WBC, you either have leukemia or lymphoma. So leukemia, it is there in the blood, so peripheral blood and bone marrow are involved, and lymphoma is more systemic or tissue involvement, so it has the lymph nodes and spleen are involved. So leukemia can become lymphoma, lymphoma can become leukemia. To identify leukemia, you do flow cytometry and use immunophenotypic markers, whereas to identify lymphoma, you use histopathological diagnosis by markers. So leukemia can be divided into acute and chronic, and again in chronic you have ALL and AML, acute myeloid and acute lymphoid, and CLL and CML, and similarly in chronic. And in WBC neoplasms you have lymphoid, myeloid and dendritic cells. So in dendritic cells you have Langerhans cells, histiocytosis. In lymphoid cells you have ALL, chronic lymphoproliferative disorders. Here you have myeloproliferative disorders, myelodysplastic syndrome, okay, and AML.